Caring for adult patients with suicide risk in the ER. Your patient is never going to directly tell you that they want to commit suicide unless either they are in severe crisis or they are trying to get attention. Even those that are trying to get attention, you really need to take them seriously. Observe their verbal and nonverbal communications, like statements, expressions of hopelessness and worthlessness, feeling trapped, withdrawal from friends or family, people that they care about. Assess for their behavioral and emotional red flags, like their previous suicide attempts, any substance use, giving away anything that they care about, risky and reckless behavior, and sudden changes in their mood or behavior. Also look for cutting, because sometimes that also leads to suicide attempts. Identify risk factors and life stressors, like any mental health disorders they may or may not have been diagnosed with. Chronic illnesses, recent trauma or loss, pain, and lack of social support. There's quite a few suicide risk screening tools that you can use, but I'm going to talk about more of those in a minute. And always trust your clinical judgment and follow up. Consult with other mental health professionals and escalate care immediately. Never, never, never ignore warning signs, as it can save lives. Three evidence-based tools are the PHQ-9, which is the Patient Health Questionnaire 9, SAD Persons, and Nurses Global Assessment of Suicide Risk, the NGASR. The PHQ-9 is widely used in all sorts of different settings as a depression screening tool, and it does specifically ask about suicidal ideation. You use it specifically to ask about thoughts of self-harm or suicide and how they've been feeling lately within the past 2 weeks. It's an aid to determine whether the patient needs a suicide risk assessment right away or not. And SAD Persons gives a framework for figuring out whether patients are suicidal and how to help them. And then performing a suicide investigation, finding protective variables, assessing risk level intervention, recording and following up. SAD Persons stands for sex, age, depression, previous attempts, ethanol abuse, rational thinking loss, social supports lacking, organized plan, no spouse, and sickness. When you need a quick assessment to figure out if someone is in immediate danger and if they require mental health care or to be hospitalized, you really want to use this. The NGASR is an all-encompassing measure for gauging the seriousness and urgency of suicide thoughts and actions. By analyzing their previous attempts, their present ideas and intent, and it also classifies risk levels. Asking a set of predetermined questions covering topics such as suicidal ideation, intent, and plan. And the patient is given a risk rating based on their responses, which then kind of determines the course of care. It's used in a range of settings to consistently and swiftly assess patients' suicidal thoughts and feelings, allowing for timely and appropriate intervention. Being able to figure out if someone is suicidal is very important, and there's a lot of different ways that you can do that, be it just from an assessment, just from talking to them, but it really, when it comes to evaluating and treating them in the emergency rooms, you really, really, really want to fall back on your tools so you know that you're asking the correct questions. You really want to detect the underlying depression that may worsen those suicidal thoughts and really try to empower your patients and potentially save lives. In Oregon, for adults, there is no direct law stating if you have to report them. but you do talk to like your mental health professionals, your physician, to see if they need to actually be hospitalized for this 72-hour hold to make sure that we save their lives. Sometimes it's just a helping hand. Sometimes it's, being able to respect them and having them feel that respect and having them feel seen and heard and understood, that really changes somebody's viewpoint and really makes them fight for themselves. And it's really, really important to always have compassion for these individuals who are suffering from depression, from possible bipolar, from suicidal ideation, and really promoting a place where they can feel safe and they know that they're believed, that they're listened to, and that we can help them. You really want to focus on their ethical and legal advocacy because you really want to protect their rights, safety, and get access to care for them. The medical providers can do these psychiatric holds, but you also want to abide by HIPAA laws and make sure that they don't feel alone, helpless, or ignored. And they really, really deserve your compassion, your empathy, your willingness to help somebody in need and not judging them. When you are advocating for social justice, there are many reasons why it's important and many ways on how you can go about it. You want to ensure fairness and really look at the person and not their wealth, where they come from, their race, their gender. You really want to focus on the person. And it's really important to do that because then they feel seen, they feel heard, and they are more willing to work with you. You want to reduce that stigma and really have ethical and patient-centered care. And you can do that in various sort of ways, making sure that the patient knows that you are there for them. Quality improvement is so important because it really comes down to patient safety, efficiency, treatment standards, being able to get and use efficient evidence-based interventions. And you really want to adhere to the ethical and legal standards to guarantee that no patient is ignored, left behind, or feeling unwanted. When you do that, you're improving not only the quality of healthcare from the system, but you're also supporting the mental health and doing suicide prevention with these patients.